All right, good morning. This is the WellMed Charitable Foundation Caregiver Teleconnection Series. We are fortunate enough today to have a presentation that is so timely. It is what do caregivers and seniors need to look for in a long-term care facility, also known, I guess, especially here as a skilled nursing facility. And I have to tell you about our incredible speakers. Lucy Barylak has a master's degree in social work from McGill University. She's presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative practices and approaches to caregiving and presents annually at international and national conferences. Lucy's also a consultant for private industry in the United States, such as WellMed Charitable Foundation and their clinics in Texas. In addition, Lucy would like you to know that she was a caregiver for her mother for 10 years. And Elliot, Dr. Elliot Montgomery Sklar, is a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually on Zoom, I guess. And his research is focused on the complexity of issues related to aging and caregiving. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, and as it relates to our program, he is giving 2 presentations this month at the American Society on Aging meeting about our caregiver teleconnection program. He has also recently published research in the American Journal of Occupational Therapy, the Journal of Applied Gerontology, and the Journal of Social Services Research on themes related to our series this month. We've been busy, Elliot. So with that, would you folks please begin your presentation?
Good morning. Lucy, you're on mute. We can't hear you.
Hi, good morning.
Good morning, Lucy.
Thank you, Evelyn, and welcome everybody. You know, our session today focuses on a very important topic because as much as it is, our desire to age in place as long as we can, sometimes there comes a point where we need more care for ourselves or for those who we are providing care for. So let's be honest, very few people dream of living out their golden years in a nursing home. The very idea sparks dread in many people. Even before the pandemic, most Americans said they wanted to age at home. That was 76% of those 50 and older, according to the survey by the AARP published just ahead of the pandemic. I think it's important for us to begin by exploring some of those reasons why people hope to avoid long-term care. But before we go any further, for those participating today, what are some of the reasons that you would want to avoid long-term care, either for yourself or for your loved one? This is a good way to start our conversation today. So let me hear from you.
And if you are participating today on Zoom and you don't have a camera or a mic, you can also participate by inserting comments and questions in the chat box.
Thank you, Elliot. And for those of you who are on the phone, just press *6 and we'll see that your phone is open. Well, I don't see anybody, but let's, there we go.
Cost is a big factor.
Yep.
Definitely, and something we'll talk more about later in this program.
That's a very good point that you made, yes. The reality is that as many people live longer, they will require more care for complex and chronic health conditions. Believe it or not, the number of Americans age 85 and older is expected to top 19 million by 2050, okay? There comes a point for many caregivers in which difficult decisions need to be made about long-term care placement And I hope our program today provides a forum to discuss what caregivers need to consider, as well as to discuss your own concerns. But I do want to say something, that there are times placing a loved one can be a better choice for them and for yourself, especially if your loved one needs more care than what you can provide because of your physical or mental well-being. We're going to talk a little bit about it. So even though the idea behind it seems like we always look at it in a negative way, in many times it's more beneficial for the loved one to be in a long-term care setting and receive the proper care, and for the caregiver to still be part of their lives, but be able to have some respite and some quality of care as well.
Absolutely. I think it's also so important to address why many people want to avoid long-term care in the context of our discussion. Yes, there are practical things like costs, for example, but something that was sort of imprinted for me is growing up. My mom always used to joke that if she needed to be placed in a long-term care facility, she'd rather that I shoot her. She had a very dark sense of humor, but the comment really always stuck with me. My first real job was actually in a long-term care facility in my community where I was a full-time volunteer. My great-grandmother had been a resident of the facility. She had Alzheimer's disease. And after she passed away, I continued to remain part of that care community. I used to help with art therapy classes, and it was such a positive experience for me because I saw some of the residents really come to life when a paintbrush was placed in their hands. And to me, that was an honor. So my view of long-term care was a very positive one because of my own personal experiences, very different than my mother's perspective. What I think I've recognized is that most people don't want to consider long-term care or even think about it because it's a reflection of their own view upon declining health and mortality, which is a very heavy thing to deal with. It may also be the recognition of declining health of a loved one. So it's really, I think, very important to acknowledge those feelings and concerns so that information about long-term care can be processed a bit more objectively, and so that decision-making becomes a more objective rather than an emotional experience or process. So I was curious from our participants today, what are your thoughts about what long-term care means to you?
If you phoned in, please press *6, or you can unmute yourself on Zoom.
I know it's a loaded question and a heavy subject, but I encourage those participants listening in and participating today to sort of keep that in mind, because the simple discussion of long-term care and consideration of placement often, triggers these kinds of things that we think about, and it becomes emotional.
And there is such, I'm sorry, if you don't mind, Elliot, there is such a stigma attached to long-term care. And I think because some people who maybe take a tour for the first time, they come in and maybe someone's just had an accident in the foyer and it smells like urine, and they're going, oh no, never have anybody here. But, it takes more than, 5 minutes in a place to get to know it.
Yeah, absolutely. And we're going to talk actually about the stigma as part of our program today too.
Great.
Well, I have to say that as I was a caregiver for my mother, and I knew that she really wanted to stay at home, but maybe it was because I was working that profession, I really had to think about it even way before the time to kind of prepare myself and prepare her. Deciding to move your loved one into a nursing home or assisted living facility can be a very difficult decision, riddled with conflicting feelings of guilt, relief, anxiety, and grief. However, recognizing the signs that it's time for a higher level of care than you can provide at home is key to the health and quality of life of your loved one and yourself. So it's really important. And if you're caring for someone, especially when they have dementia or any other physical problem, people deteriorate. So it is important. So it's so hard to pinpoint an exact time as to when a loved one might be ready for placement in a long-term care facility. It's important to keep an eye out for some signs that the care your loved one needs might be beyond your ability. So let's look at that. So if you have to lift a loved one and you hurt yourself, that's really a big one. Your loved one's disability has progressed to the point that safety is, it's endangered. So it's not just about you, it's about them too. Your loved one wanders and gets lost. I mean, that's a big one for caregivers, how to deal with that. And then there are the challenges with incontinence. I know a lot of caregivers say once they're going into diapers, I don't think I can do it anymore. Other major responsibilities are being neglected to the point of creating problems for you or your family. You're experiencing chronic caregiver burnout. You have a right to have a life. Your health is declining. Your personal relationships are suffering. You can't meet all of your loved ones' needs. They're becoming more physically and emotionally and sexually abusive towards you, or you may be becoming mentally or physically abusive to your loved one. And that's a hard one to take. So remember, it's okay to feel sadness, grief, and even stress about moving your loved one into assisted living. But keep in mind, it could be the best for their health and happiness as well as your own. So I know we're asking you guys a lot of questions. I'm going to ask you another question, and maybe you'll feel a little bit more comfortable to answer. So if anyone participating today considering long-term care because of any one of these challenges or others that you may want to share. So I'm just wondering if you are a professional online, what are your caregivers' experience? And maybe you can share a little bit of that. And if you're a caregiver, I'd love to hear from you too.
If you're on the phone, press *6. Otherwise, you can unmute your Zoom call. And I think we have a question from Sandy White.
Yes, I have I've experienced I had to get guardianship of my mother years ago because she had dementia and was living alone in Texas, and we live in Illinois and nobody lived there. So that was a horrible process. If she had just agreed to go to assisted living much earlier, then she would have been much better off. But it just didn't happen. And then now my husband has had 11 strokes and a brain injury because of hundreds of falls, and he's completely incontinent, and he's home. I'm trying to keep him home as long as I can, but I have looked into long-term care facilities and know where I would want him to go if I can no longer keep him at home. So I think, you try to stay very present and not worry too much about the future. But I think it's important to also have some plans in place that you don't have to, in the middle of a crisis, be looking at long-term care facilities and all the stress of that. So I would just encourage folks, I know that people don't have a lot of time, but to just try to plan some of those things out so that you're a little more prepared when the time might come. My husband had asked me after his first strokes to promise that I would never put him in a facility. And thank goodness I had presence of mind to say, that's not a promise that I know I can keep, because I just didn't want to add the guilt to the difficult process of making those decisions.
Good for you.
I have to say you're an extremely wise woman, and thank you for that. Because the guilt is overwhelming, and just the fact that you prepared yourself and you were honest to even tell your husband that. And I wish you all the best.
Oh, thank you so much.
Thank you so much for sharing.
Lucky to have you.
I think there were a few other things on the chat, but I don't know how to manage that.
Tani Garcia wrote, I'm considering for my mother who has dementia. Her needs are now beyond what I can provide. And Debbie said contemplating putting my mother in care as she has Alzheimer's, and it's getting to be too much for my father. They're both 80.
Well, I think we're going to be addressing a lot of those issues. And so thank you for your comments.
Any last thoughts or comments from anyone before we move on?
If you're on the phone, just press *6, or you can unmute yourself on Zoom. Okay.
All right. Well, I think the pandemic heightened many fears and concerns about long-term care placement. About 8% of people who live in US long-term care facilities have died of COVID-19, nearly 1 in 12. Now, there are many reasons for this, but a main one is that age is the greatest risk factor for severe COVID complications, and many long-term care facilities house older and more frail individuals with significant health issues. Excuse me just a moment, I have a little frog in my throat.
Take your time, Elliot.
Thank you. I think another important distinction is that the data that we have about how COVID impacted long-term care comes only from publicly funded nursing home data. Now, this data has been generalized to all of long-term care, including assisted living, but it's not a true comparison of apples to apples. And in fact, many nursing homes had to take in patients who were discharged from hospitals, and they were there because they had COVID. Now, these patients were not properly quarantined because nursing homes are not designed for that. So long-term care has gotten a bad rap as a whole, which has further exacerbated a lot of the negative stigma that you were talking about, Evelyn. I think also a major concern for caregivers right now is with regards to visitation and what could potentially happen during another COVID surge. So I think it's really important to ask and to look up this information based upon the state in which you live. Last month, the Florida legislature passed a bill that would make it easier for people to see their loved ones in long-term care facilities. At least 8 states have already passed similar laws, and several others have bills under construction. Now, some laws, like those passed last year in New York and in Texas, are specific to long-term care facilities. They allow residents to designate essential caregivers, sometimes these are also known as compassionate caregivers, who are allowed to visit regardless of whether there is a health crisis or not. Texans also have added protections in their constitution. Now, while the visitation laws open the doors, they also include provisions to protect patients and staff by directing facilities to establish requirements for health screenings or mask requirements. It really depends on the state. In Florida, for example, protocols for visitors cannot be more stringent than they are for staff, and vaccination status cannot be a factor. Now, this is such a hot topic issue, and I'm curious to hear from our participants today. How are you feeling about this? Does it give you a sense of relief or a sense of concern?
If you're on the phone, please press *6, or if you're on Zoom, please unmute yourself. We would love to hear from you. It is, especially if you're looking for placement, this is, it's a big deal. It's something you really need to think about and know what's going on. Anybody?
All right.
I just have a comment to make that
Yeah.
I know that all these regulations are to take the masks off, but on a personal level, I have to say, I'm keeping my mask on when I go shopping or in certain places. I think everybody has to do what they're comfortable with. Yeah.
And Debbie W is saying, I'd personally like a place where vaccines are required for staff to keep the residents safe. And I have to tell you, I so agree. I just don't want somebody coming in a nursing home where my mom is or my dad is and not wearing a mask. I just, just feel like it's a dangerous situation.
Yes, And that is the concern that I think a lot of people share. But again, it's not necessarily true across the board. For example, some private long-term care facilities I'm aware of have their own policies and have since the beginning of the pandemic here in Florida, where masks have not been necessarily a requirement. So we need to always remember that, you know, the information that we provide and what is available, it may not be true in every facility or true in every state as well. That's why our local AAA offices are so important in getting localized information. And I'll talk a little bit more about that later when we talk about cost. But I actually have a question for you, Lucy. We've talked before about fluctuations in staff in long-term care, and that's an issue that's been going on for a long time, even pre-pandemic. So what can caregivers do to better support their loved ones in long-term care right now?
That's a good question, Elliot. Yes. The percentage of nursing homes reporting a shortage of nurses or aides have been holding steady at about 30% for 4 months. With the surge in COVID cases, the percentage of nursing home reported a staffing shortage. In January, it jumped up to, in the pandemic, jumped to 39%. You know, this data is from the AARP, who has kept a dashboard on long-term care since the pandemic began. So this means that for caregivers whose loved ones are in long-term care, please keep open communication with the facility and to continue to monitor the precautions that the facility is taking. Very much what you were saying, Elliot, Evelyn. Make sure that your loved ones are boosted and that they have items like masks and hand sanitizers. Also be sure to communicate with their doctor about the second booster, which is recommended for people over 50. The shortage of staff is a big problem. I mean, that was a problem before the pandemic. You know, when people had to, individuals had to take care of 7, 8 people at the same time. So it's even worse now. So really, caregivers, you really need to keep an eye on that. Those staff shortages in mind, and to keep communicating with your loved one and also communicating with the staff. Show you their appreciation to them. You know, the more they get to know you, somehow because of human nature, they'll have more of a connection possibly with your loved one. And so I just want to talk a little bit about what you might want to do a little bit more. Some of the activities may not be going on in those facilities as they were before. And so, you know, consider suggesting a variety of activities that you might want to do when you do visit your loved ones. You can bring puzzles, you can bring games, you can do reading with them, you can go for a walk. Even do some exercises in a chair, but please ask the doctor first. You don't want to put your loved one at risk. It's important that family comes and visits, and maybe you can take turns and have a schedule so that the burden is not necessarily always on you. Not that it's a burden, but that other family members come. You know, there's arts and crafts projects, paintings, whatever it is that you know your loved one is enjoying. Reminiscing is a great therapy, you know, for stimulation and quality of life, looking through photo albums, creating a scrapbook, telling I remember when stories. A lot of people really like to do that, especially if they have some form of cognitive impairment. They seem to remember a lot more in the past. Reading, saved letters or greeting cards. I keep all my cards for my kids, I have to say. So maybe one day we'll look at it together again, listening to music, eating a special family recipe together. I have to tell you, that's a really important one, to bring goodies from your background and your culture that are not in those facilities.
So since you're talking about background and culture and cognitive stimulation, all very important things, are there specific things that caregivers should be looking for or questions to ask as they're exploring long-term care options?
Well, I put lots and lots of them, so I'm going to go quickly through them, just keeping in time, you know, the time frame. Especially if you're a person with dementia, have unique needs which should be addressed specifically during the process of identifying a facility. I think it's important to know what training does the staff have to work with persons with dementia. What is the staff ratio as we talked? I think that's important for you to know. How does the staff handle difficult behaviors such as bathing and wandering? How often are residents bathed? In some places, once a week is the norm. Is that okay for you? Does the staff speak the language of your loved one? I mean, these are things that you really need to look at. It's not always going to happen, but you need to be comfortable with it. Are individual care plans maintained to each resident? How does a resident get medical attention? Is there a doctor available who keeps hours in the facility? For outside medical appointments, do the staff take them, or is there an expectation that you do it? Are there specific visiting hours for families and visitors? If so, what are they? You want to feel, I knew that I wanted to come and visit my mom anytime I wanted to, and I don't want anyone stopping me. Why would you? Is the facility secured for wandering resident? How does the staff handle residents going into another resident's room? Is there a support group for family members? What does the facility respond when a resident is having a difficult time adjusting? How are they going to cope with that? And again, these are general questions that, you should be thinking. What kind of structure activities are scheduled through the weeks? Are there any religious services in the facility if your family loved one is prone to wanting to go to that? What about day trips? Are residents allowed to bring their own furniture and belongings? So there are many questions, but this is a big one, which I'll talk about a little bit later. Can the kitchen accommodate a special diet if they're diabetic or they're vegan or whatever the reason may be? But one of the things that's so important is the staff pleasant? Is the atmosphere warm and friendly? Does the staff greet residents like adults? I can't stand when staff speaks to seniors as if they were children. Are the residents, is it clean and well groomed? Does the residents seem unnecessarily, do they seem unnecessarily medicated? Again, so these are all the things that you kind of would look at, or safety issues in the bathroom and things like that. I will be addressing the question a little bit later towards the end, but I just wanted to kind of throw a couple of thoughts and things that you might want to consider.
What a great list, Lucy. And people are asking for a copy of it.
Oh, okay. I will definitely send it out with the resources after the session. Definitely.
Wonderful. Someone earlier mentioned cost, and we're going to come back to that again and again through our session today. But many people are concerned both about cost and about quality of care at long-term care facilities. And that was the focus of a recent Kaiser Family Foundation report. I love their reports, and this one came out just a few weeks ago.
Excuse me.
Now, in President Biden's most recent State of the Union address, he outlined steps to improve care for residents at nursing homes, assisted living, and other long-term care facilities. The latest polling finds that nearly half of adults, including 51% of adults 50 and older, worry about being able to afford long-term care services like nursing home care, and less than half rate the quality and cost of care in this country's nursing homes as positive. So we talked before about stigma. A majority of adults say this country's nursing homes, assisted living facilities, or other long-term care facilities are doing a bad job of maintaining adequate staffing, of offering affordable care, or of providing high-quality care to residents. Many say the country's nursing homes are doing a good job, however, of protecting residents and staff from COVID-19, which I thought was interesting. So I don't know if the people who responded actually have loved ones in long-term care. This could just be a reflection of general public opinion, but I was curious what the opinions are of our participants today.
So folks, please, you can unmute yourself if you're on the phone by pressing *6, or just unmute your phone or unmute yourself on Zoom. Well, I really like that people are feel like they're being protecting the residents and staff from COVID. That's a good finding.
It was interesting to me. I think many people are still, as a whole, concerned about quality of care and cost.
Mhm.
I would agree with that. I think that there's still a lot to be done, to maintain people and give them the dignity. But I think it goes back to really researching. And I'm going to talk a little bit more about that. So even if you're not prepared just yet, and if if your loved one or yourself has a progressive disease or any other cognitive impairment, it's important to really know what's out there and to have a good idea. So I totally agree with developing a plan. The stigma that often accompanies long-term care, as Elliot just shared, doesn't help caregivers when making these difficult decisions. Also, there are many kinds of long-term care facilities. Some are larger, others are smaller, some are private and independent, and others are publicly funded and regulated. Okay, that's important to keep in mind. So let's talk about assisted living residents or facilities, sometimes called ALF, which is a housing facility for people with disabilities or for adults who cannot or who choose not to live independently. Typically, most facility centers, they're mostly for older adults. So assisted living is the shift from care as service to care as business in the broader healthcare arena. This is a consumer-driven industry, okay? So what I'm talking about, it's a business. And as such, assisted living offers a wide range of options, levels of cares and diversities of services, and are subject to state rather than federal regulatory oversight. So what assisted living in quote means depends on both the state and provider in question. Assisted living evolved model of skilled nursing facilities. There are more of these kind of facilities than nursing homes because they function more like businesses, as I said. As more people age, there is more demand for long-term care, and these facilities do not need to wait upon government funding to match supply and demand. So you need to keep that in mind. So these facilities typically provide supervision of assistance for activities of daily living, ADLs, coordination of services by outside healthcare providers, and monitoring of residents' activities to help to ensure their health and safety. These facilities can be very expensive, as Richard was saying before, more than $5,000 a month, and not everyone can afford that. This is why planning is so important so that you know what options are available for you and for your loved one.
Absolutely. And, I think our session today really addresses what caregivers and seniors need to be looking for in order to make a decision on what is right for them. And while there are so many choices and options as it relates to long-term care, it's so important to consider the costs and insurance options that are associated with long-term care. Some people have long-term care policies, but most don't. Now, I was debating whether or not to include this slide, which is from Regions Bank. It was something that they had recently published as a tool to help people with their financial planning for long-term care. The reason I was hesitant to include it is that these costs might not be a true reflection of where it is that you're living. And it might not be true across the board. We know that this varies a lot from community to community. And so I encourage you to please reach out to your local AAA for specific information about costs in your area. This information is really more of a national type of a model to work from. But as you can see, the costs are significant. Now, there are a lot of options for long-term care and how to pay for that. It's difficult for us to go into all of them during our session today, but it's important to know some key differences between Medicare and Medicaid for the purposes of our discussion. Now, Medicaid is a public assistance program that is based largely upon financial need or disability. Unlike Medicare, which is a federal program, both your state and the federal government fund Medicaid in the state in which you live. Medicaid covers many seniors who are at an advanced age, typically because of a disability. Whereas Medicare is really an insurance entitlement. You can think of it as health insurance provided for seniors. It's just like regular insurance in the sense that there are premiums to pay, and many of our participants know that. Sometimes those premiums are sizable. Now, if you're 65 and older and you can't afford healthcare coverage, I would recommend that you apply for Medicaid as well. We'll think of today's session as more of a focus on Medicare on Medicaid than Medicare, because Medicaid is actually the benefit that covers beds in nursing homes, which is why it's so important to address this benefit. The National Council on Aging has some really amazing tools and resources on their website with more information that we will be sharing after our program today. Now, the majority of people in nursing homes for long-term care use Medicaid to pay the bill. As you see here, the monthly bill would be significant. The average cost of nursing home care is well over $225 per day, and very, very few families can afford to pay that out of pocket. One would think, as such, that getting a Medicaid eligible aging parent into a nursing home would be a relatively easy process, but unfortunately not the case. There is a lot of nuance with regard to Medicaid acceptance and complexities of nursing homes. It's not a simple or a fast process, and so that's why planning is so critical. Now, there are multiple issues that can be combined also to make the process even more challenging, such as the limited availability of Medicaid beds in nursing homes, and also the fact that most nursing homes will not accept a new resident unless they have a way to pay for their care, and Medicaid will not accept the applicant until they've been admitted into a nursing home. So it's really a catch-22. So we wanted to outline some very, very basic steps and let you know again that we'll be providing some resources after our session today from the National Council on Aging, which has, to me, some of the most wonderful and comprehensive resources that go into a lot more detail and provide a lot more assistance. In addition, as I mentioned, your local area agency on aging should really be a first point contact in your community. It's important to work with a social worker and other skilled professionals who can help in decision-making and advising you within your community and also your state. And the National Council on Aging provides this 4 pieces of advice on how to get a Medicaid nursing home bed. And the first is to create a list of nursing homes in your area that accept Medicaid. There's a link in our resources that we'll be providing. The second is to contact admissions at each of those facilities and see if they accept Medicaid pending clients. And the third is, if they do accept Medicaid pending, ask admissions at the nursing home if they have beds available. A nursing home might have, for example, 100 beds, but only 50 might be allocated to Medicaid beneficiaries. If there are no beds available, request to be put on a wait list. You should know that wait lists do not require a financial commitment, so you should try to get on as many wait lists as you can find acceptable nursing homes. And the last important step is, if you haven't already, be sure to apply for Medicaid, but only if the family is certain that the applicant will be approved. Another small catch-22 there. So we have a Medicaid eligibility pre-screen along with our resources for today. Again, from the National Council on Aging. It is a free pre-screen, and we recommend that people take it. It's very helpful in the planning process. Now, I can't underscore enough, one of the most important things is doing all of this research early, as one of our participants said earlier, so that you know what your options are. The worst thing I can think of is when family caregivers find themselves in a pinch because of circumstances and they're not prepared or know what options exist. Another issue that I've experienced recently is that because people have relocated during the pandemic, many people are not familiar with the resources in their local communities. and this can feel daunting and overwhelming. So please remember to reach out to your local AAA, your area agency on aging, for help.
That's a lot of very good information, Elliot. And I'm just wondering if people have a question for you.
Okay, folks, excuse me, if you're on the phone, please press *6. If you're on Zoom, you can unmute yourself.
I think there was a few comments. If I just take a look at there were some comments.
Sandy said, I can't recommend enough to consult with an elder care attorney as early on as possible. And Richard shared that's another reason to do advanced planning. I agree on both points. And the elder care link will be sent out as well with our resources today.
Hello, I have a comment. I think it's called distinct part. Not only to find out who accepts Medicaid, but to make sure that the facility doesn't have like a limited number of Medicaid beds, meaning that if you go in to the long-term care facility as full pay and then qualify for Medicaid, you can stay there, because there are times if their limited number of beds are full, the patient could have to be moved to a Medicaid facility, and you know, under those circumstances, you might have to go to a place that you're don't think as good a quality, or might possibly be further distance from your home that you didn't want. So that was something that I was informed about by our attorney, as well as I've talked to, a lot of different nursing home or senior support services folks who recommended that. So I don't know if that's helpful.
And that's a
is
tough
super
one
helpful.
because people go to rehab under Medicare, for 20
Right.
days or however
Right.
long they need it. And then, they find out that the place that the hospital sent them under, for rehab doesn't have any Medicaid beds available. So it's a tough,
Right.
that's a tough
Right.
one.
Exactly.
And it's super helpful information. As I said, there are so many issues with regard to payment that we could dedicate multiple sessions just to that.
Right.
And that's why we didn't go into transition of care. Many people can't afford to pay out of pocket and wait for Medicaid to be approved, for example. So the examples we provided were simply if you know that you're already Medicaid eligible. It's challenging to find those beds, certainly. So, but there are a lot of nuances, and transition of care and payments is certainly one of them. And thank you for that information.
Thank you, Sandy. Anybody else? Love to hear from you. Our podcasts are so much more interesting when our caregivers share with us.
Well, we got Sandy said to everyone, thank you so much for this list.
Yeah, it's a great list.
Helpful. Okay, so as I mentioned earlier, the idea of a nursing home placement is something most of us don't want to consider at first. However, we can't all offer full-time in-home care, and nursing homes or care homes can really be the best option for someone who needs 24-hour high-quality care. This decision will be much easier if you give yourself the time to research, as we said that before, and to give people the opportunity, especially other family members, there's other siblings around or which are feeling that you should be taking care of that person 24 hours. And if you start doing the research and if people come together, it's a much better outcome for the loved one, but unfortunately, most people don't get much time to make this decision. There is often a rapid change in the individual's mental or physical health that requires immediate placement. Other times, the placement begins when the individual needs to stay in a nursing home while they are recovering, let's say, from surgery. So if your loved one can still make choices or decisions on their own. Their wishes should be very clear and you should honor that. It is very important that you acknowledge your options and act accordingly. All right. Sometimes it's so easy to make decisions. You think it's the right one, but a person has the right if they're competent enough to make those decisions. However, if an impairment has caused this level of thought to be difficult for your loved one, you need to be ready to make decisions on their behalf. Making the final decision on a nursing home care placement will come with some challenges. It is an emotional time, and options may differ greatly between the individual requiring care, yourself, as I said, and other family members. So I would highly advise that a professional, such as a social worker, a doctor, or any other healthcare provider, can be very helpful in this situation. And you can call 211 for help, for resources, or contact your local area agency on aging to support you in this process. Okay, so don't hesitate. It's not a, and many times if you do meet with a professional, you can have a family conference where everyone is involved. People have an opportunity to express their own feelings. And again, if the person is competent, that person should be part of that process at all times. So I want to summarize some key points for our session today, whether you are looking for a nursing home, a care home yourself, or on behalf of a loved one for long-term care. These key points will help you make the best decision. I think that location is key. When considering different nursing homes, location is one of the most important factors to consider. If you're the one needing care, you will want to be close to your family as much as possible. If you're looking at nursing homes for your loved one, you should be able to easily visit your loved one frequently. So the other thing is the size of the nursing home is also extremely important. It should be based on the unique personality and preference of the person that needs one. For example, you can ask yourself or your loved one questions like, is this person more introverted and quiet or social and outgoing? These are important things to keep in mind, you know. Would a place like a lot of other people around provide a better environment for this person? Are these places where he or she can get out, can go outside and go walk around? If so, are these places easily accessible and safe? Does the facility have enough room to offer quiet areas and activity space so that the resident can decide what they want to do at any given time? And of course, you need to look at the services. Though they all offer long-term care, different nursing homes offer different services and healthcare. So it's crucial to find out which ones are provided by the homes that you're considering. While some services are essential for meeting the specific needs of residents, others are just as important for improving their quality of life. So for example, the meal and dining experience have been shown to make a big difference in the overall satisfaction of nursing home residents. Food is so important. Think about it. Most people, you know, they look forward to, they had breakfast, so what's going to be for lunch and supper, etc. So it's important to even go and have a meal at a resident just to see what it's all about. Again, I'm going to emphasize again, we talked a little bit about staffing. You know, the staff members at a nursing home are going to be the ones ensuring that your loved one's safety and their attitude, experience, and professionalism is extremely important. You should always ask plenty of questions and spend some time observing the staff before making a decision. Not only the staff, but you should speak to other caregivers if you see them and ask them, how is your loved one being taken care of here? While you observe, you should look for staff who possess skilled nursing care and personal care, but also demonstrate a polite, warm, and respectful relationship between the staff and the residents. You can also see if the staff knocks on the resident's door. They don't just barge in, okay? Entering, and if they call the resident by name. These are really very subtle kind of things, but they make a huge, big difference because it tells you how your loved one is going to be treated and respected. You know, so then there's choice and independence. moving to a nursing home is a scary experience for most individuals. They often feel that they want their freedom to make their own choices. While it's true that they could not do many of the things they used to, some aspects of their lives can and should remain up to them as long as they are mentally capable of doing so. This is something that should be considered during the decision-making process. Choices like even the side order of what they want to eat. Can they have potatoes or can they have broccoli? What activities they want to participate in, when to go to bed and wake up. I know that's an issue, a big issue. And many of them, everybody goes to bed at 8 o'clock, but some don't. Some do give the person an option. If the individual receiving care is still mentally healthy, the last place you want to put them in is a home where their every move is controlled totally by the staff. And then look for red flags. You should. You can find the nursing homes with the bad reputations for care by doing a little bit of research online. So Medicare.gov offers a very helpful search tool that provides reports on different nursing homes based on zip codes. They rate these facilities on factors such as staff, health, inspections, and more. So if the nursing home you're interested in isn't showing many stars, you should take a look at other homes, before you make any decisions. As I said, it's not an easy decision to make, but if you can just take the time, I think in the end, it's going to be very beneficial for you and your loved one. I think there's a comment there from Sandy White.
Well, we've had a couple of comments. We also had one from Richard saying that, sometimes when a hospital transfers somebody or somebody gets in there first, there's criteria for entrance. And if a person has dementia, that they have like 4 to 6 weeks to see if they actually fit at that facility or if they need to be transferred to a memory care facility. You want to respond to that, Elliot or Lucy?
It will have to be Elliot since he's in the US.
I think it is true across the board that some facilities, and I know this from my experience with my grandmother, for example, in Canada, we tried out a couple of different facilities until one was a good fit for her. She did not meet the criteria of certain facilities. And that is very challenging, certainly. That's why we also recommend definitely you work with your local area agency on aging, plan however much you can if possible. It's very much the same, for example, with what I said about Medicaid. It's something that you want to apply for, but only if you know that you're going to be approved, which is not how things should be. So that's why planning, advance information, all of this stuff becomes so important. And really during our program next week, we're going to talk about family dynamics involved with some of these very difficult decision-making, but also because a lot of people have decided during the course of the pandemic and because of our inflation to take in loved ones and to care for them at home, which is causing additional burdens financially, emotionally, physically. There are so many nuances involved. And like I said before, we can't get into everything during the course of our programs, but different facilities do have different admission requirements. And when you call the different facilities, ask not only just about Medicaid eligibility, but also about what those requirements might be.
Thank you,
And
Elliot.
Sandy told us that one of the benefits to a large county long-term care facility is that they have lots of volunteers coming and going, as well as churches and other community organizations providing music and other programs. I'm not sure how many counties have a large long-term care facility. I know there aren't many in California.
I will say that this is true in some instances, but not in others. We've talked in our previous sessions in this series about family style or green nursing homes, which are smaller, typically 10 to 12 residents. They've been popping up a lot more recently. And part of that is because of how well they've done during the pandemic. It's much more like a house where people have individual rooms and can have easy access to the outdoors. But many of those facilities have a lot of programming and activities. It's easier for them to schedule because they're not a large facility. So that's, again, a very important question to ask, I think, and I thank you for bringing that up. To ask of the facilities is what their volunteer base is. As I mentioned earlier, to me, I took my role as a volunteer in a long-term care facility, helping with art therapy very seriously when I was a student in college. But it was something that was very close to my heart and something that I really enjoyed and that nurtured my being. So I think those kinds of interactions are very important and mutually beneficial.
Thank you. I just want to bring up one thing that we didn't talk about. It touched me with my mother. My mother was a heavy smoker, like a pack and a half a day smoker. And when looking for a facility, I had to look for something first, a place where there was a smoking room. So, these things need to be taken into consideration. And I'm sure there's other issues as well. So I just wanted to mention that.
I know we're approaching the top of the hour, and I know, Evelyn, you have some information to share. So I am going to just move to my next screen, which are some of our resources from today. Evelyn, while you share some of that information.
Great. Folks, you will be getting these resources with the post-session questionnaire that you'll be receiving in a couple of days. We so encourage you to fill out that questionnaire because it helps us continue to try to improve what we're doing here at the Caregiver Teleconnection. Now, you're only going to get these if you were registered for the session. So if you got the number from somebody else, please call our customer service representative at 866-390-6491 if you're not registered, and get yourself on our list, and you'll be really happy because you're going to get a lot of different information on the upcoming sessions that we have. Now, I want to encourage you to look at our podcast because there are, so many of them on www.caregiverteleconnection.org. We also, Elliot will send out, I think we've already given out the Alzheimer's number, but we can add that one right, to the list because they can give a lot of help in terms of who they work with, which facilities that they know of that work well with Alzheimer's patients. Now, many new sessions have been scheduled, and you may have that information already, but I'm going to just tell you to be sure and clock in next Wednesday for the last session in this series when it's absolutely necessary for a caregiver to place their loved one. And as Elliot said, they'll be discussing family dynamics, which is always a tricky place to be when you're placing someone. And with that, I would like to just thank all of you for what you do. I would like to thank our speakers for another beautiful, well-researched, well-delivered job. And I'd like to thank the WellMed Charitable Foundation for supporting caregivers in clinics, community centers, these sessions, and for that information-filled website. And I want to thank you all so much. Wish you a good and safe day, and we'll see you soon.
Bye, everybody.
Thanks, everyone.
Take care.
Thank you all so much.
Thanks. Bye-bye.